Good evening, and this is another News for You live stream brought to you by Freedom Media WA. There is in Western Australia a perfect storm brewing for COVID-19 declaration to be made. Many would know that for some time now on social media platforms, there's been a strong inclination that the Coldplay concerts this weekend, where some 130,000 people will be taking to Optus Stadium to listen to Coldplay, will be the catalyst for a super spreader event. Today, Roger Cook, the Premier and former Health Minister, announced about 3.5 hours ago on his social media platforms this announcement. Let's have a look. And I'm going to read this out for you. He starts off by saying that in this case here, you may have noticed that there has been an increase of COVID-19 in the community. As a result, there has been a rise in COVID hospitalizations and hospital staff off sick. We need to do what we can to make sure we're keeping each other safe, especially our most vulnerable. That's why, based on the latest health advice, I'll just bring that up again for you, that from Monday the 20th, that's this Monday, staff and patients must wear surgical masks in high-risk hospital clinic areas, including hematology, oncology, organ transplant, renal dialysis, and also around vulnerable patients in the critical care settings like intensive care units. Additionally, masks must be worn and recommended for all healthcare facility staff and visitors to clinical area in public hospitals. It's a measure that will reduce the spread of COVID-19 and help keep our most vulnerable safe. It's easy to do the right thing. That is what Roger Cook has been posting across all of his social medias about 3.5 hours ago. I just watched a little bit of mainstream media footage, and in particular Channel 7, 9 and 10, and what they're talking about this particular thing. Should Western Australians be concerned about this? Absolutely, and here is the reason why. I'm just going to bring you, I've been certainly following this for about the last couple of weeks and just looking at certain things that have been coming through on mainstream media, and I'm going to bring you now a package. This is the ABC, and this is what they had to say just recently on this, the lead up to this. Let's have a look.
WA's about 10 weeks into another wave of infection, which could be worse than the last two.
Even if you're feeling better towards the end of it, it takes generally 4 or 5 days before you've cleared the virus and become less of an infectious risk.
People are urged to check they're up to date with vaccinations, with fewer than 1 in 10 WA adults having a booster in the past 6 months.
Look, I expect it will track upwards a bit further. It is always hard to predict where it will end up.
But he isn't forecasting disaster or new restrictions.
So there we go. That is coverage from the ABC. As you heard, that's the Chief Health Officer there, Dr. Andrew Robinson, who's been wheeled out to give that particular piece of information. Interestingly, that I see from that particular package there, they're talking about encouraging people to stay home, and both James Carmody from the ABC and also Dr. Robinson, the Chief Health Officer here in Western Australia, said stay home for 5 days and perhaps longer. Now, many people would have well and truly exhausted sick leave from that they may have had from the last couple of years. And it's interesting that the government is coming out advocating that these measures are coming into play, telling you to stay at home for at least 5 days. The question is, there is no support around that for those that may not have the sick leave to be able to do that. And at a time where the cost of living crisis is an absolute pinnacle, then and it's absolutely hurting and crippling people, not only here in Western Australia, where the economy is purported to be in a healthy condition, but right across the nation. So people can ill afford to take sick leave, and in particular, unpaid sick leave. Now, I just want to also reiterate that the mask requirement that Roger Cook has announced this afternoon, that some 2 weeks ago, he actually was asked the question because of increased COVID numbers that whether he sees the likelihood of COVID restrictions being reintroduced back into Western Australia. And he was very clear with his answer. That answer being no. He doesn't see that yet. So we've now seen today that he's gone back on that, and there's more to be concerned. Let's just have a look at what Roger Cook has said on masks in the past.
My understanding at the moment is that the public health team don't believe that N95 masks for those particular workers is appropriate. To wear them as a My understanding at the moment is that the public health team don't believe that N95 masks for those particular workers is appropriate. To wear them as a perfectly fit and healthy person in the street is not going to provide you with any greater level of protection.
So apologies for a wrong button press there. So that's what he said, no, not once but twice, that from the archives of footage that I've been able to bring out for you, where he's said that perfectly healthy people do not need to wear masks. In particular there, when he's talking about the hospital setting, N95 mask, that is a rated mask and one that you must undergo fit testing in order for that to work effectively. And it's interesting to note, as been covered in the past, the Chief Health Officer, Andrew Robinson, was asked the very question with his heavy beard, how he can get a seal in relation to that mask. So now I'm going to also talk to you, the reason why I say that this is a concern, this is the perfect storm brewing, because many will remember back in August last year that we had the Kill the Bill that saw a number of unprecedented numbers of people take to Western Australian Parliament to protest against the Emergency Management Amended Temporary COVID-19 Provisions Bill 2022, which has now been enacted, that is in place. It's just ticked over 1 year. It has about 11 months to go. That saw some very, very onerous conditions being introduced, namely that if a COVID declaration is made, that police have the power without a warrant to kick in your front door and give you a health direction without a warrant. As I said, it's just absolutely unprecedented that something of that nature, those particular powers. And on that note, I'm going to bring you a little bit of the Emergency Services Minister, Stephen Dawson, back in October last year, where he actually acknowledges in the debate for this bill the powers that this actually gives. Let's have a look.
The threshold for making a COVID-19 declaration is lower than the threshold for declaring a state of emergency, and the threshold for the making of a COVID-19 declaration is provided for in Section 77C, where a coordinated response to manage COVID-19 and the need to exercise powers during a COVID-19 declaration are required. Why is the State Emergency Coordinator making the declaration rather than the Minister for Emergency Services? Well, the declaration is informed by elements of the existing declaration framework, as I indicated. The making of a COVID-19 declaration by the State Emergency Coordinator is consistent with their current ability to make an emergency situation declaration for any hazard under the Emergency Management Act. And the State Emergency Coordinator, being responsible for making the declaration, also recognises their experience and ability to coordinate and manage the state's response to COVID-19. The State Emergency Coordinator also has the appropriate level of experience and authority to make decisions for the COVID-19 declaration.
So there we go. What does all of that mean? His acknowledgement there by saying that the powers that Stephen Dawson had as the Emergency Services Manager to implement a state of emergency, that a COVID declaration is a lower threshold. And that is of very, very significant importance because, and not only all of that, there was and that was quite rightly pointed out, there was absolutely no ministerial oversight if a COVID declaration was to be made. Now that means that it doesn't matter that Roger Cook has been saying in the last couple of days that he doesn't see restrictions coming back in place. He's now gone back in his word. He's started, as of Monday, announcing mask restrictions will be coming back in, starting with the hospital and the health environment. We all know how that turned out and where that ended up going. And it doesn't matter what he says, because if the Police Commissioner, Cole Blanche, makes the decision that as the uptick in COVID is likely and spreading within the community, as acknowledged that in the package that I've just showed you by the ABC, and they're talking about, the ABC made comment that 1 in 10 is due for their booster. Now, I had a look at the figures before I started sort of compiling this stream to bring it to you in the last sort of 3 hours. It takes a lot to get a little package like this, so just bear with me. But essentially what you're talking about, the current figures that is publicly available, is that about 1.9 million West Australians are overdue for their current booster. Now, I don't even want to go into the argument of actually what defines a current booster, because I don't know, I wasn't able to establish what that number looks like, other than I can tell you that it's been clear the West Australian government has made 5 shots available. And we've heard we brought you scenes talking about the motion that the Honourable Ben Dawkins brought earlier this week in COVID, and we heard Steve Thomas from the Liberal Party say that no vaccine is 100% safe, no vaccine is going to stop transmission. But I would perhaps argue and add one further thing to that, and that is that no vaccine that's looking to combat flu and cold-like symptoms requires people to have that vaccine on a 3-monthly basis. I mean, even, and I must say that Steve Thomas is a doctor, but he's a doctor of veterinary science. It may be the case in the veterinary world that you might have to inoculate animals on a 3-monthly basis. I don't really know that, but in terms of human vaccination, I mean, it's been absolutely unprecedented. So, so there we go, about $1.9 million. If that becomes of concern to the Police Commissioner, who is the Emergency Services Manager, a person who has been given the blessing by the West Australian, then McGowan-led government, now Roger Cook-led government, Labor government, if he feels that this is getting to a point, and you would just have to switch on any of the mainstream media TVs, and if he's sitting at home and thinks now is the time to act, then we could potentially be looking at a 3-month COVID declaration lockdown. And that would mean, and let's, again, to refresh our memories with that particular bill, he can choose to lock down all of the state, part of the state, one suburb and not another, and they're in and they are some of the things that can happen. It would give people that would have no training, for example, a shop assistant, the authority to ask for your personal particulars if you're in a shopping centre and you are not complying with a mask requirement, whether that be, and the Act also had no provisions to consider exemptions, and that, or whether that be an exemption from a vaccination or an exemption from mask wearing. And that is of particular concern. Now, what I am going to do, I just really wanted to bring a brief stream there. I can see that there's a number of people watching this. I think it's important that the Honourable Nick Goren, he actually was right on this debate back in October last year, and it was a bill that the WA Labor Parliament absolutely rammed through. There was limited debate on it, and it actually got to the point that there was a number of issues with the bill that the Honourable Nick Goren was pointing out, And he even said at one point, we are just not going to get through because the then Premier Mark McGowan introduced a motion to direct the Parliament to sign off on this particular bill. Bearing in mind the unprecedented step, which I covered in a previous stream as well, is the Governor, the ex-Police Commissioner, now the Governor of Western Australia, that's Chris Dawson, he sent a message to Parliament whilst the bill was still going through to say that I am sitting here with my pen in hand to sign off on this bill as soon as it comes in. That's the extent of what's at actually play here. And I'm going to bring you some of the debate between Steve Dawson and the Honourable McGowan on this particular issue. Let's have a look.
The powers under the new part are appropriate and will facilitate the effective management of COVID-19 over the next 2 years. The power of the State Emergency Coordinator to make the COVID-19 declaration, they're extraordinary powers for dealing with an extraordinary situation that continues to go on. Now, I don't agree with honourable members who have said that we're giving the State Emergency Coordinator too much power.
Honourable McGowan.
So, Minister, do you understand that the threshold is changing here? That you, as a Minister of the Crown, you can't make one of these declarations unless you're satisfied that it not only requires a coordinated response, it requires a significant and coordinated response. But a person who's not a Minister of the Crown, a person junior to you in seniority, a person who currently reports to you, from now on, he's not going to need to be concerned as to whether that requires a significant response. He only needs to be concerned if it's a coordinated response. Is that accepted by government, that the threshold is being lowered here?
Minister.
Thank you. Government accepts this is an appropriate way forward. So we stand by the bill that's before us. It may well be that the bill might not need to be used in the next few weeks or the next few months, but COVID-19 is out there, and it could well be that new variants come into being. The making of a COVID-19 declaration by the State Emergency Coordinator is consistent with their current ability to make an emergency situation declaration for any hazard under the Emergency Management
because
Act.
It requires.
Honourable McGowan.
You say that it's the same, but when there's an emergency situation declaration, does the State Emergency Coordinator need to be satisfied that only a coordinated response is required, that lower threshold, or does he or she need to be satisfied it requires a significant and coordinated response?
Minister.
So in this bill, we only do require that coordinated response. However, as I said...
So it's not the same then? There's no point of saying it's the same when it's not the same.
As an emergency
situation declaration is the same as a state of emergency declaration, but clearly not the same as a COVID-19 declaration.
It's definitely similar, honourable member.
Oh, similar. I thought you said it was the same. Same or similar?
Members noting the time I need to report progress to the House.
And there you go. I just wanted to play the last bit that where the acting speaker said, noting the time they need to report progress. That particular package was taken well late into the night on October the 18th, 2022, last year. That's how much there was a push from the Labor government to ram that bill through. Of course, when the acting speaker came back, it was essentially the end of the debate. I can see your comments coming through saying that the government has way too much power. There is a very, very distinct difference between a COVID declaration and a state of emergency. The one thing that a COVID declaration that I would say the main point is can't do, and that's implement purported borders. We don't really have borders in Australia, but we have state lines. It can't implement state line lockdowns by stopping people crossing a state line from one state to another or coming in. But everything else that the state of emergency that we previously experienced could do, the COVID declaration made by the police commissioner. He doesn't need to seek consultation. It can implement a wide range of rafting powers that will see an absolute attack on civil liberties, the nuns, the like that we haven't seen before. You saw in that package there, the Emergency Services Minister, Stephen Dawson, said that it may be likely in the next few weeks, few months, that this bill, which they ran through, may not needed to be used. But the fact is, it's in for 2 years. It has a sunset clause. And today is a very, very telling sign, certainly not wanting to create that fear, but people need to be aware of potentially where this can go. So on that note, I'm going to say, wherever you are, thank you to those that have commented. I really just wanted to bring a quick stream and a little bit of a package to set some context around what is actually going on here, because having watched the legacy mainstream media at 6 o'clock, they are really dumbing down the significance of Roger Cook's announcement that as of Monday, in the health environment, that people now must wear masks. So on that note, wherever you are, thank you for commenting. Please share this stream so that people can get some information, some forewarning, and perhaps they can start to work out how and what they are going to do for their family's sakes between now and Christmas leading up, should things develop, should the police commissioner declare a COVID-19 pandemic. Enjoy the rest of your evening. I'm Lindsay from Freedom Media WA, and this has been another live stream brought to you by News for You. Thank you very much.
Brought to you by Freedom Media WA, where journalism should never be a government narrative.